of transplant evaluation?
It's an extensive workup for transplant. The patients are put through a series of testing and many appointments and with many different disciplines, and then are eventually presented to a board.
Once the medical review board accepts the patient suitable for the heart transplantation, we see them in the hospital.
So we come back and we tell the patients that they have been accepted for transplant, and that's a big relief. So once they're listed, the unknown variable obviously is a time frame.
The process for waiting for heart transplant is nerve-wracking for both patients, physicians, everyone. We want to keep them alive. We want to provide hope and encouragement to our patients.
Easy to get very attached to the patients that are here long term. They are in the hospital for extraordinary lengths of time, anywhere from 1 to 2 days to up to a year, and all of the times that are in between. And they become part of our family.
We celebrate birthdays, we celebrate anniversaries, we've even had a wedding. It's the best thing, I think, whenever you come in, you get to build that bond.
Working here, I get to know the patients and their families. It's wonderful.
We are notified when there are potential organ donor situations, and then our talented staff go to the hospital, do the medical evaluation with the hospital staff about the potential for donation, and then when appropriate, we talk with the families of the donors or check to see if the individual's in the Donate Like Texas registry. And then once we have that match list, if any of the patients at Memorial Hermann's heart transplant program come up, then we would make the offer for that heart to that center, to Memorial Hermann.
We review the offer with our doctors, and if it is a suitable match for a patient, we will proceed.
One of us as team physicians will go and talk to the patient in particular, as well as their family members, that donor heart is available for transplantation.
You can't explain the feeling. I can't imagine being in somebody's shoes, thinking that they're going to die and be gifted the life that was from someone else that decided, whose family decided to donate the organ even in such trying times. In fact, it's 2 lives that have touched us. That sympathy and empathy we have, it takes us to a greater level, and we appreciate life much more.
Chad watched the movie 7 Pounds with our daughter Jessica, and just told our daughter that if anything ever happened, he wanted to be a donor. He was always, like I said, willing to help anybody do anything. And so 2 weeks later, my son had a motorcycle accident, was life-flighted, and ended up in a coma for 9 days. It's just incredible to know that my son's heart is now beating in another man's body.
So the actual transplant is done in tandem with 2 teams. So one team goes to procure the organ, evaluate and make a decision whether the organ is suitable for the donor, and the other team gets started here with the recipient.
Time from the cross-clamp of the aorta on the donor to the reperfusion of the new heart needs to be under 4 hours. Time is really of the essence at that point.
Coordination is done in a very, very rigid manner where every second matters. So the coordination is done by our transplant coordinator.
We help coordinate sort of the whole front side of the donation process and interface with the transplant team here at Memorial Hermann to share information, to help out on the organ recovery, and to coordinate either the local or long distance recovery of the heart, and then bringing it back to the transplant program here at Memorial Hermann, where then with the talented hands of the heart transplant team, the transplant happens.
Providing a transplant or providing some kind of definitive therapy to make their sufferings go away, it's an extremely gratifying feeling for us. We are extremely grateful being a part of their lives and making a difference.
We as surgeons, like, see the whole process at the very end of the chain, So it's a lot of effort. I mean, there is an army of people behind the scenes that supports and takes care of this transplantation.
It's a lot of hard work by a great many people, from clinicians at the bedside right through to the many, many support services across the Memorial Hermann organization and at UT Health that have needed to work together and collaborate very seamlessly to make sure that at the end of the day, each patient can be assured that the outcomes they get are the very best possible.
In 2012, actually we started in November, we did 10 heart transplants. 2013, we did another 34 heart transplants while waiting for Medicare certification. And then this past year, we've done 51 heart transplants.
Almost unprecedented, the number of transplants and LVADs that we have done. We've been very successful. Just to prove the point that I think it was done at the right place at the right time.
Memorial Hermann system has been enormously supportive, just absolutely. What the physician just hopes for, you know, how you can interact and work together with the institution and the leadership.
Great leadership paired with physician leadership is what really grows services and service lines, and that's the exact approach we took for our heart failure and heart transplant program. And so we recruited over 600 staff to join these positions just in their first year of operations because of the significant amount of patient volume that's come to our hospital as a result of them joining Memorial Hermann and UT.
If there's a will, there's a way, and we strongly felt that our team would be able to establish this. And I'm very happy for what we have done so far, and we still have a lot more ways to go.
Probably going to see much more transplants, and we're probably going to go about 100 transplants a year.
We are celebrating the 100th